Assalamu alaikum, the communication day. The first scenario, Mrs. Rana, 24 years old, present with recurrent attacks of abnormal movements. CT was clear and the EEG confirmed epilepsy. Please talk to Rana, explain the diagnosis and reply any concern. Let's start timing. Yeah, here you go.
Hello.
Hi, hello.
Hello, I'm Dr. Lamia, the doctor of Nerve Clinic today. May you confirm I'm speaking to Mrs. Rana, 24 years old?
Yes, doctor.
Hello, Mrs. Rana. Mrs. Rana, we are here today to discuss issue related to your health condition. Is it okay for you?
Yeah.
Okay, Mrs. Rana. Do you want anyone to attend this meeting with you?
No, I'm okay, thank you.
Okay. Can you tell me, Mrs. Rana, how much you do know about your condition?
Yes, doctor, I have this problem with the shaking all over, and I've done many investigation. This CT brain they did for me, and also some tracing for my brain, and I'm now waiting for the results.
Okay, Mrs. Rana, I appreciate your knowledge about your health condition, and I'm sorry for what you are suffering from. Yes, as you told, you suffered from this attack of shaking of your body, and yes, your brain imaging is done and brain tracing, and the result is unfortunately the result not as we hope. Yes, the result is good, but the diagnosis not as we hope. Um, do you have any expectation about your condition?
No, I didn't have an expectation, but what do you mean that the results is okay and at the same time the diagnosis is not good? What does that mean?
Um, your result, your brain image and brain tracing was normal, showed no abnormality and nothing worrying. But as your condition is recurrent, your diagnosis now is called what is called epilepsy, which is called mostly functional epilepsy. Do you have ever heard about this condition before, Mrs. Rana?
No, never. Is it serious?
Um, I appreciate your worry, Mrs. Rana, but let me know first. Let me first explain to you your condition. Your condition is occurred due to abnormal electrical activity of your brain, leading to this shaking movement that you are suffered from. This condition will be serious if not treated, if not controlled. So what we will do now, we will refer you to a group of doctors, including nerve doctors, specialized nurse, occupational health worker, and social worker. And so mostly you will start medication to control your condition. How is this sound for you, Mrs. Rana?
Yes, doctor. So you mean that there is a treatment and for my condition. So why all this worries?
I really appreciate your worry, Mrs. Rana, but your condition is not treatable right now. It is controllable. You will be controlled on medication, on your regular medication and regular follow-up. Right now, we will start you on medication and we will follow you regularly.
Okay, so I will never have this type of seizures again if I have the treatment.
I appreciate your concern. Yes, if you control, if you will be compliant on your medication and regular follow up in the clinic, yes, your condition will be controlled and will not. You will live near normal life.
Okay.
Is it okay for you?
Yeah.
But I need to ask you some question, Mrs. Rana.
Okay.
Do you smoke?
Yes, I smoke around 5 cigarettes a day.
Do you drink alcohol? Sorry, I advise you to stop smoking because it is injurious for your life and your health condition. So I can refer you to a smoking cessation clinic so they can help you regarding this issue. Okay?
Okay. Is it affect my condition?
Yes, smoking is dangerous for your health condition, and your condition will be affected also.
Okay.
Do you drink alcohol?
Yes.
Uh,
Social.
okay, Mrs. Rana, do you drive?
Yes, I drive for work.
Okay, I advise you right now to stop driving and inform DVLA, and you will be evaluated to see when you will start driving again. Okay.
Okay.
What are you doing for living, Mrs. Rana?
I'm a coach, a swimmer coach.
Swimmer coach. Okay. Okay, Mrs. Rana. This condition, in your condition, you should be. You can practice your swimming, but you should be under observation because this attack may come, and someone need to help you. Okay. So
Okay.
we can refer you to social work, to occupational workers who can help you as regards this issue.
That means, is it dangerous to continue swimming?
As I told you, Mrs. Rana, I appreciate your concern, but I'm sorry to tell you that your swimming will need to be under observation. So as you are a coach, I don't know if it's available to be under observation or not. So the occupational health worker will discuss with you this issue. Okay.
Okay. Okay.
Mrs. Rana, do you have partner?
Yes.
Okay. Do you have children?
I have one kid.
One,
Yeah,
one child.
one child. Yeah.
Okay. You have any pills, contraceptive pills?
Yes, I use contraceptive pills.
Okay, Mrs. Rana, and I advise you to because the medication of this epilepsy will may affect your the efficacy of your contraceptive pill. So I will refer you to women doctor and nerve doctor to choose a suitable method for you. Okay.
Uh, Okay, so what do you mean by that? Is that it is affecting my contraception?
Yes, it may affect the efficacy of this medication.
Okay.
Okay.
Mhm.
Okay, Mrs. Rana, I want to ask you also, do you have any concern, Mrs. Rana?
2 minutes left.
Uh, yeah, there's just a lot of things. Just I try to take all this information in. At the moment, I'm not thinking about concern, specific concern.
Okay, Mrs. Rana, uh, do you live in upstairs or first floor house?
Yeah, in house.
Okay, I advise you to avoid going upstairs nowadays to start your till you start medication and your condition will be controlled. And also, I highly advise you not take bath nowadays to take shower, and better to keep the bathroom door open to if in order if you have any attack at any time, anyone can help you. Also, I need you to avoid the late time sleeping and night flashes. All this may precipitate the attack. Okay.
Okay, doctor, but my bathroom and bedroom all upstairs. I have it's just one floor.
Just one floor. Okay.
Yeah, so I have I have like double bed, and the I have the reception downstairs, and upstairs I have my bathroom and my even my bedroom. How can I avoid being there?
We can arrange this with the social workers to see how can we help you, or better anything to be under observation, or uh, to avoid having an attack without observation or without help.
Okay.
Okay. Do you have any other concern, Mrs. Ram?
No, thank you.
So I can give you leaflets, brochures, and website to read more about your condition, and also the hospital contact number. If you want any query, you can call us at any time.
Okay, doctor, thank you.
Okay, time is up. Well done, Dr. Lamia. Let's hear the comment from Dr. Mayada, then I will comment.
Yeah, well done. I think you touched most of the things relating to epilepsy. The only thing that I didn't understand why you stop her from getting upstairs. This is not dangerous. Maybe the dangerous things for these people is the uphills, like if they are in adventure or something, they are going uphill, it will be dangerous for them. But at home, it doesn't dangerous. It will not danger their life. You can advise them at this time under observation. This is good idea, like not to be alone until the action of the medication and their epilepsy is controlled. You touch most of the things that's important in this case. That's driving is important, and swimming as well. Uh, Also, you touch about alcohol. It can be trigger factor uh, for their symptom. Alcohol can be related and smoking as well. Any stressful condition for their life. You touch the contraception. I think most of the things that you are get touch with it. Yeah. Yeah, I finished.
Okay. Yeah, thank you, Dr. Mayada. But I have some comments for Dr. Lamia
Okay.
regarding the introduction when she tried to break bad news, but she said it like assuring in the same time. She said everything is okay, but I don't have good news for you. So it's not matching. Either to say,
The result as not as we hoped. The result
yeah,
is normal. What I do?
yeah, but the EEG
أنا
is not normal.
normal. EEG.
No, no, EEG confirm epilepsy. By the way, you mix, I think
Clear.
you are confused
CT
with the
was clear
diagnosis.
and EEG. CT was clear and EEG.
No, no, no,
EEG
no.
normal.
There is
صح؟
EEG
coma. There is
confirm.
coma.
إيه؟
EEG confirm epilepsy. Read the scenario again.
مم.
The CT was clear,
مم.
comma, EEG confirm epilepsy.
مفيش كوما and EEG. يعني هي جملة and EEG confirmed epilepsy
Yes,
مع
and the
بعض.
EEG confirm
اوكي.
epilepsy.
طيب.
CT was clear and EEG confirm epilepsy.
تمام. اوكي.
Okay, that's why I wrote in in the comment, it's not functional epilepsy. I think you did the scenario as functional epilepsy, but take care. EEG was
اوكي.
confirmed epilepsy. Anyway, you didn't repeat this sentence again. You didn't say this is functional seizure or functional epilepsy, which
اوكي.
is your luck. If you do in the exam, I think they will minus you. So take care of the diagnosis. Always read the scenario many times to deliver the news well. So let's assume the situation now is different. You have the epilepsy itself, not functional. How you can deliver the news? What you will tell her?
Um, I have your result now, and unfortunately, it's not as we
Yes,
hoped.
perfect. Yes.
Mm.
So it will be as breaking bad news. And why
Okay.
breaking bad news? Because epilepsy, yes, sometimes it's curable, but it's like a lifelong disease, and the patient take medication for a long time. So it's any medication or any disease need to be treated for a long time. you can consider as breaking bad news, particularly if it can affect her job. You address that in the introduction. You address that also in the function and the job also. Sorry about the swimming. You ask her to be watched. She's the one watching others. But
مم.
again, yes, it's okay. You can also advise her whenever she's trying to do swimming to be watched by others. It's
Okay.
okay. But I don't think you need to reallocate her or to call social or occupational. She just need to be watched if she's practicing swimming. Okay?
she need to be watched ولا not to be watched.
To be watched, but not to be reallocated because you told her we will call or we can include the social or
Because this is the coach, she is the coach who will observe her يعني she is the
yes,
observer.
any accompany.
Mm.
Just advise her whenever you want to do swimming to be accompanied by someone else, her colleague or her friends. That's it.
Okay.
Okay. This is regarding the job. The driving, I think yes, it should stop driving and inform the VLA. She did it. Someone wrote she didn't, but she did it earlier. Maybe the one wrote that she joined late. The other thing, the yes, is social smoking, alcohol. All the things are in danger her life, particularly the smoking. It's something need to be stopped, and if she need help, you can refer her. This yeah, climbing the stairs is. I think it's not necessary to be advised through. Just you can advise if she need help at home, if she can cope with her daily activity, who's living with her. Keep asking this question: who's living with you, and who's dependent on you? Okay. For the question of OCP, you can say birth control pills because OCP is a jargon. Maybe in UK, Dr. Mayada, they can accept it, but I think in overseas, better to say birth control pills. And you have to ask about any plan for pregnancy. If she's planning for pregnancy, supposed to take medication which is compatible with the pregnancy. Lamotrigine, I think. But
Yes.
you ask for OCP, I don't know what the relation between the OCP and the anti-epileptic. Is it you mean for the liver? I'm not sure about this.
Interaction, drug interaction.
Mm.
Drug
It decrease
interaction. Mm.
the anti-epilepsy decrease the action of
Oral contraceptives.
oral contraceptive. Yeah, it decrease the action.
Okay, so there's interaction. I think through the enzymes, liver
Yeah,
enzymes.
it will.
Cytochrome V40 or
Yeah,
450.
inducer. It's
They are inducer. Okay.
inducer, so it will be. The
Okay.
only thing that in this scenario, it's for me. I will not like start like breaking bad news. Breaking bad news. I will say for Hala. I will see how what she feel about the diagnosis. She have this investigation. If she has any idea about what it may be
Yeah.
or an
Yeah.
expectation. If her expectation is so bad, like if she's concerned about cancer, so this will not be bad news for
Yes.
her.
Perfect. Yes.
According to what she expects, and
Mm-hmm.
if she expect the bad, this may be good news for her.
Yeah.
So
Yeah.
I think expectation here is important. So it leads
Yeah.
the
I
scenario.
perfect. I prefer to ask expectation, Dr. Lamia, before giving the possible diagnosis. I think here you give her the the possible diagnosis, then you ask her what's your expectation, or you break bad news, then you ask her about the expectation. Anyway, as Dr. Mayada said, if she's expecting something bad, you can say it's not that much bad. It's epilepsy, and with medication, you might live near normal life. But if she said, I think everything is okay, doctor, now you can break bad news, there is something alarming, which is epilepsy. The epilepsy is a condition where electricity or inside the brain being higher than expected, and it can go through the nerve cables, make abnormal movements. Sometimes it might affect your awareness about the surrounding, and in certain condition, it might threat your life. You have to give her alarming that in the severe form, she might lose her conscious level, and if no one noticed, it might affect her life, right? This also red flags should be given at the end of the scenario, that if she's alone, she should be accompanied with someone. Because you're lucky this lady living with her husband and her kids. But if she told you, no, no, doctor, I am alone, you can give her some red flags. Since you are living alone, please take care. Someone need to be accompanying you while living. Because if you have these attacks while you are living alone, it might harm your life. Don't lock your door inside while taking shower. Don't be alone for a long time. Should be accompanied with someone else. Okay? These things for the follow up and for the care post appointment or post discharge give you good marks. So you have to take care about these points. Clear, Dr.
Okay.
Lamia?
تمام. Okay. Okay.
Okay, any question?
No, thank you.
Any suggestion from others? Dr. Aisha, you have any suggestion here? You can, sorry, Dr. Aisha, if you are talking, yeah, yeah, very far. Okay, you can post your scenario, Dr. Lamia, in the
Okay, تمام.
chat box.
There is bracelet also wearing in epilepsy or no?
I think card,
Card?
not bracelet, card,
Okay.
yes.
Mm-hmm. And about hobbies, it's very important also in with job
Yes. If
in
she's,
epilepsy.
yeah, like to do hiking,
Diving
diving,
more.
hiking.
Yes.
Yeah, it can be given as red flags at the end, certainly.
She explained what is epilepsy.
Yeah,
I'm
earlier you
in the
joined late.
early. Okay.
Yeah, you joined late, I think.
Yes.
But she
Yes.
explained that electricity being higher and firing more impulse through
And
the
she
nerve
raised the
cables.
concern that will be cured or something like that.
She said yes, it might be controlled with some medication.
Mm-hmm. Okay. And she asked if I can stop medication anytime or.
No, she didn't raise.
Mm-hmm.
The surrogate didn't raise. Good
Yes,
question.
and
So let's
as
ask.
you
Yeah.
said about pregnancy, you should be planned because some medication will
Yes.
differ. And also contraceptive also should be planned because some of them not affected by the medication of epilepsy.
Yes, perfect. Let's ask Dr. Lamia this question. If the surrogate asks you, Dr. Lamia, when to stop this medicine, what do you think?
I think يعني مش متأكدة I don't sure
Okay, you are not sure. Of
two
course,
hours
no one will be sure. So
if
give diplomatic answer. Give me diplomatic answer. As a
I
rule,
don't.
in basis,
Okay.
don't give frame time. Don't give
Okay,
me.
ممكن
Yeah, so
if if you are for period seizure free and your EEG brain tracing is free for some period, I don't know exactly. You may stop your medication. And also, I don't sure from this result. I can ask my consultant and come back to you.
okay. Okay, this is accepted answer, but let's
Mm.
say it in another way.
Mm.
Whenever your seizure or your abnormal movements controlled on medication, we will give you follow-up appointment in our clinic and we'll update you about next further plan. Don't tell her I don't know. because we know that it's 2 years. If you
Mm.
are sure, you can say 2 years. But if you are not sure and you are not the neurology, you can say in the next appointment. And if you are free of this seizure and abnormal movement, we can update you about the possibility of changing or stopping this medication. Okay. Always be diplomatic in your answer. Don't give clear answer. But if you know the information, so you can say after, as you said, sometimes couple of months, couple of years, some person or some patient respond to this medicine, and they can stop this medication soon if they are controlled with this medication. Okay.
Okay.
Perfect, Dr. Lamia. Let's start the other
There
scenario.
is also a concern
Okay.
that I don't that the surrogate will be like resist to start the medication. So better firstly to speak about the harmful of these attacks about on your brain and on as a side like trauma or something like that.
Yeah, I think I mentioned earlier, right, that it might
Yes, yes.
create
You
your
speak
life. Yeah.
about that you will, I think, warn her that if she has attack, she can harm
Yes.
herself like that.
Yes.
Yeah.
Yes.
Mhm. But
Yes.
she can speak about it early because already she will speak about epilepsy, so she can add what is why it is we will not her having these attacks before starting that she need medication. She will take it daily like that.
Mhm. Yes, perfect. So the compliance is important also to be mentioned here. You have to be compliant to your medication. It can let you live your normal life.
Yes, and so it can also lead it by the surrogate if she is resistant or she are keen to start medication because there is other scenario. She has only one attack and she asks for medication, and it is the counter, like the opposite. That
Yeah.
you will
It,
advise that we can wait, but you will
okay.
consider at the end meeting with consultant, another meeting, and explaining more like that because she. I think in scenario, let's insist about starting medication.
Mm. Negotiation.
Yes.
Yeah, I think the task will be different and the scenario will be also different. It's not counseling about epilepsy. It would be convincing a patient to start anti-epileptic medication. It would be another,
Reassurance.
yeah.
Yes.
So it's different task, but the same topic, which is epilepsy.
Mhm.
Hopefully, the counseling is much easier than negotiation because in the negotiation you don't know what they want from you. What the point to stress on, what the point to avoid, and maybe even you are explaining the maybe you didn't reach to the point they needed from you. But the counseling much easier. You can convince, you can talk about the disease, how the complication, how to be managed. Anyway, we should be ready for any scenario. Any other point, Dr. Aisha?
No, thank you.
Okay, thank you too. Dr. Maeda, your scenario: 34-year-old man has presented to the hospital following a large upper GI bleed. He has history of non-steroidal anti-inflammatory drugs use for chronic back pain. His initial hemoglobin is 7.5. Your consultant is coming in to perform an endoscopy and has asked you to consent the patient. You have managed him according to the hospital guidelines, including prescribing 3 units blood transfusion. The nursing staff have called you, however, since the patient wife is refusing the blood transfusion, you are initially unaware that here and the patient are Jehovah Witnesses. Please discuss this with the patient's wife. Oh, Dr. Lamia, since long time we didn't practice this topic. Thank you.
Mhm.
It's okay. We have to refresh our minds about these topics, although it's rare to come in the exam, but we have to practice them. Good luck, Dr. Maeda. I will give you 2 minutes, and if you're ready, just let me know. Dr. Muhammad Jalal, when we use ICE in the communication, in the beginning or later, what is the ICE? Can you send the scenario again? Yeah, okay. Can you,
Yes, I see.
yes.
Hello, Assalamu alaikum.
Yeah, yeah. Carry
Yes,
on.
idea, concern, expectation.
Idea, concern.
Expectation
This is from the start, at the beginning.
from the beginning.
Yes, the background or the idea
Yes.
and the expectation. The concern you can ask after hearing 2 minutes left.
Okay.
Okay.
In every
At
communication
the
like
end.
this.
Yeah, in every scenario of communication, introduction include the idea or background of the disease or any background about the condition, then
Okay.
the expectation, followed by the expectation.
Okay.
And the
Thank you.
concern will be asked at the end, or even in the middle. You can ask, you have any concern? Are you concerning something you want to tell me about? So it's not a matter of 2 minutes only. You can ask it in between, just to know what's hidden there in the scenario. They might tell you something he need to deliver or instructed by the examiner, and according to your answer, you get the mark. So he might have a lot of concern, and if you waited for 2 minutes to ask his concern, he might have a lot of concerns, and you might not have the time to explain and to address the whole concerns. So if your scenario is short, you can finish the task and immediately ask him about any concern. If you want to ask the concern at the beginning, it's okay. You can ask, but please don't ask and ask him again. Either to write it down or you can address it early. But I think some concern it could be answered during the task. For example, in this scenario, he might be concerned about about the driving or about his job. So anyway, you can address this while doing the task, and this is your task to address the job or the swimming, for example. But it's okay to know it, but take care to know it and not to answer it. What I mean, if he told you about it, but you didn't address it, you will be in trouble. For example, you will be busy explaining the condition and you will forget his concern. So you'll ask him again, what was your concern? That's why better to ask it after finishing the task. Finish your task, ask about the concern, what you want me to tell you, what are your concern, better after finishing the task. Why? Because the task also have marks. Okay? So
Okay.
either
Thank you.
at the middle or at the end. If you want to ask him earlier, you can ask and write in your paper that the patient asked me to do or to about this concern, and I should answer him later on. So you cannot address the concern at the beginning. For example, some concerns, I mean. But if you can address it, you can address it. Clear?
Okay. Thank you.
Okay, thank you.
Sorry, now I'm discussing with the wife or the
Yeah, the wife. The wife.
can I have name for the patient?
Yeah, you can ask during, but Dr. Lamia can provide us a name. Please, Dr. Lamia.
I sent already Mrs. Sarah, wife, the patient Mr. Jones.
Okay.
The wife name Sarah and the patient name, sorry.
John, Mr. John.
If you're ready, Dr. Mayada, we can start.
We can start, yeah.
Yeah.
Hi, hello. My name is Dr. Maida, one of the medical doctors here. Just I want to confirm that I'm talking to Miss Sarah, Mr. Jones' wife.
Yes.
Okay. I understand that Mr. Jones gave us a consent to talk to you. regarding his condition. Can you tell me what concern you have?
Yes, doctor. My husband, John, has a long history of back pain, and he was receiving medication, painkiller medication, which caused problem in his tummy and lead to bleeding, too much bleeding, and causing a drop in his blood. So I brought him to the hospital. And they told they want to give him blood.
Yeah.
And it is in our beliefs, we are Jehovah Witness, and in our belief, it is not allowed to receive any blood transfusion.
Okay, I can understand that. Okay, so in the hospital, we have a policies regarding when someone come with the low hemoglobin that means low blood, as your husband, he came in a very critical situation, that when he arrived to the hospital, what we normally do, we stabilize our patient, and that's why we give him this blood. At that time, we don't know about his beliefs and what he's preferred, because he wasn't fully aware about, and he was in very critical position. And as a doctors, we save lives. We give him the blood transfusion at that time.
Yes, doctor, and also I'm very worried about him, but we can't accept this blood. It is our beliefs. Our community will not accept this.
Okay, I can understand that. I will, and this is your right to have the decision to have the blood transfusion or no. But it's my duty just to tell you the importance of that for him. However, there is another alternative, but at the same time, this alternative is not working fast at the blood transfusion. And we can give him some like ions. This is the also we can give that. It's a type of medication that can help to raise his bloods. However, it's not working very fast, and things can happen, and things can go either ways. If he's not taking these bloods, he may his condition may deteriorate, even it can cause his death. How you feel about that?
Okay, doctor, I understand you, but he would never accept also. It's against our belief, and even if it's life-threatening.
Yeah, I can understand that, and I know this is hard and I'm not against any beliefs, but you need to be aware about all the circumstances, and things can happen. And in this time, what we're gonna do that because you have these beliefs and you are refusing to have the blood transfusion. As I told you, we can go to the other alternative, as we can give some like fluids. These fluids, normal saline. This
Okay,
fluids.
doctor, give him this fluids.
Okay. So just I want to let you know that these fluids will not retain his blood because he's having this blood loss. It can give sometimes for us to run more investigation over him, but I'm not quite sure that it can stabilize his condition completely. Is that okay? Is that okay with you? Okay. The second step, we're gonna do that. We need to find out why he's having this bleeding. And in order to understand why he have this bleeding, we need to go through a camera test inside his stomach and find out if there is a cause and if there is any area of bleeding, and we can stop it. How you feel about it?
Okay, doctor. Yeah, it will help him and stop this bleeding.
Yeah, if because we are thinking that there is a bleeding, the only risk factor at the moment we are seeing in his history that he's taken these painkiller medications known as non-steroidal anti-inflammatory drugs. This painkiller, it can cause some irritation to the, it can cause some ulcers. That means there is it can cause some injuries to his stomach and cause bleeding. And if there is, as far as his blood is very low, we think that these ulcers are ulcer. What I mean by ulcer, that the injuries in his stomach may be very large, causing this massive bleeding. That's why we need to stop that through this camera test. Do you want to tell you more about the camera test?
Yes, doctor. I need to know, is it safe?
Okay. So the importance of the camera test that, as I told you, to find out the cause of his bleeding, and we try to stop it. This is the importance of it. But there is also bad effect of this camera. It's a rigid tube. It can pass through his food canal, food tube, and it may cause injury there. And also it may, if there is injury, it can cause even it can penetrate through his food tube, and will be dangerous. And we afraid the risk will be high as far as he cannot take a blood at the moment. It may be more dangerous in his case. How you feel about it?
Okay, doctor, but I get worried more because of this complications that will maybe happen.
Mm-hmm. Complication, yeah, it can happen, as I told you, but there is to have this complication, it's not common, as our doctors are are professional in doing this camera type of test, but these bad effects can happen in some cases. It's not common to have these dangerous bad effects. But if we weighing the importance of having the camera test and not having the camera test, that means to weighing the benefit against the bad effect, we think that to have the camera test to stop his bleeding is important for to save his life, because further bleeding for him, and he will not take any blood, it will endanger his life. And if we weigh that, I think to go for camera test will be in his best of interest. What do you feel?
2 minutes left.
Okay, doctor. Okay.
Do you think we can go for that?
Okay, it's important. Okay, we can proceed. Yes.
Okay, so we'll talk to him as well to have his consent, and will not go to the procedure unless he's aware about it and the bad effects, and he's agreed to that as well. Do you have any more concern?
No, doctor. Only my concern only on this blood transfusion, but because if it is life threatening and he in need, I don't know if he agree or not. Okay.
Yeah, so I will have a talk with him again, and we'll see from his point of view. And if he is agreeing to have the blood transfusion, we'll go in for that, because this is important to save his life. However, the alternative that we can use for him at the moment, just to stabilize him, and it's not totally or completely saving his life, that will give him some fluids. We can go for giving him some ions, which is not working at the faster, but this is as alternative in case he is refusing that. The second thing, if he agreed to have the camera test, we'll go further to have the camera test, and we'll try to find the bleeding vessel or blood conduit to stop that. Is that okay?
Okay, okay, doctor.
Thank you. Okay, just I want to ask more question about his normal life. What he do for living?
He is a teacher, doctor.
Teacher. I think and who is supporting him at home?
We living with each other. I'm working also. We don't need support. We are supported.
Okay. Thank you.
Suppose the time is up, but I reset by mistake in between. But a total of 10 minutes now.
Okay.
Yeah, thank you, Dr. Maeda. Well done. Let's hear Dr. Lamia comment, then I will comment.
This condition, Jehovah Witness, the most important thing is what will be done is in the best interest of the patient in life-threatening condition. Whatever this patient beliefs, any beliefs, the patient has reduced the capacity now. So, and also we haven't any written document of refusal. So what we will do now is for the best interest of the patient. So if the wife insisted till the end of the scenario that she will not approve, she given any permission to receive any blood, to give him any blood, we will involve the consultant, we will involve the hospital legal team to ensure the correct procedure. Okay, but this is the most important, and the procedure is okay, done perfect, and all scenarios okay.
I think he's aware that he give consent to the wife to talk to me. Maybe
لا في patient reduced capacity, not aware.
he because in the scenario he received the bloods already.
No, it's prescribed for him, not received.
Not received the blood still.
Yeah, I read it when you mentioned that he received, but when I read it back, it was, I think it's
Still,
clear that, yeah, prescribed, not yet received.
Okay.
prescribing 3 unit
Yeah.
transfusion.
Okay.
They only informing the wife because the wife who she want to speak to them.
The scenario to discuss the endoscopy with the patient, and then the wife said, maybe it's not clear for me the scenario. It's not clear that the wife know about the wife. He for me, I understand like that the patient already received the blood transfusion, and then I want to discuss with the wife.
It's okay, Dr. Mayada. Yeah, sometimes we misunderstand the scenario, but in the exam, hopefully you can read it carefully in order not to be misunderstanding the scenario. Okay, let's address this scenario in order. After the introduction, I think you said there is consent or permission. We assume that we have permission from your husband to talk about his condition.
That's why he has consent. But if he's not aware, that means it's completely different. Yeah.
Yeah, if he's not aware, so she's the next of kin. That's why it's important to ask, are you the next of kin? Next of kin, even if he's not consented. So you are talking about something, and with someone is he's or she is next of kin, and she's the one who will be talk about his condition.
We may say we suppose that your husband will never mind to speak with you about his condition.
Yeah, any sentence can be accepted, just to show that I didn't breach the confidentiality. Okay, for the Jehovah Witness behavior or beliefs, in order to solve this problem, first thing, offering the blood itself. Some persons, they are rejecting any component of the blood, and some of them rejecting some component. So either all component of the blood or some component. That's why you have to address which component they are rejecting. For example, if you are gonna give him blood cells, or which is bagged RBCs, maybe they will accept. Some of them, they are not accepting the whole blood transfusion. This is what I know also in my mind. So to address what kind of rejection they have, is it to the whole blood or some component of the blood? If they have some component rejection, you can give the others. For example, in this scenario, if they reject the whole blood, you can tell her there is some blood, red blood cells, which is concerned to the anemia or low blood count. So you can give him only the blood cells. If she said, no, doctor, I cannot, and we have our beliefs, we cannot accept any blood component, this time that you can prescribe fluid, as you said, but it will not act as the blood itself. Be sure that it will give some time, but it's not effective, and the efficacy is not as the blood itself. Plus, we can give him some minerals or iron, as you said. It can
Iron,
give
yes.
him some support, but it will take also a long time to refill the blood again in his body. These are the solutions of Jehovah Witness families. And I think it will not go out of these rules. The endoscopy, yes, one of the, but it's not the main task here. The main task is to give and to consent for blood. By the way, at the end, if she said, no, my husband will refuse everything, as Dr. Maeda did, yeah, let's have a talk with your husband if he's fine and he is okay to sign a consent. If not, and she's refusing, we will refer to the consultant and legal advisor, and they will sit with you again, either to accept or to have a refusal form. And in this time, you have to sign a refusal form because it was in the best interest of the patient, and they rejected by themselves or refused. And for any refusal of the management plan, the patient or the next of kin should sign refusal form. Okay. Any other concern or any comment here, Dr. Manamia,
لا تمام. No,
plus the one I mentioned?
thank you.
Anyone has comment? Clear for all?
If this patient not aware, you
Okay.
should ask about power of attorney if he nominate anyone to take decision like that.
Mhm.
And even if she has, because there is one scenario that she said like that, you should also refer them to a consultant or arrange another meeting, because in also refusal of something threaten the life is not an easy thing to accept, even if she has the power of attorney from the patient.
Mhm. But I don't think they
Give
can.
for best of interest. If the patient is unaware, best of interest will give the blood center.
Yes, like that. Yes.
We manage in best of interest if he is not aware, and after that we can tell him what
And
happened.
I think, yes, you need to negotiate more with the wife about the blood, because
Mhm.
you just accept her thinks and beliefs.
Because I was thinking that the patient is aware. If the patient is aware and reject, even if it is
Even if
clear,
aware, you should speak slightly about the problem and it is life-threatening, and we can't do the endoscopy without this. If you will refuse the blood, it is very threatening to do this camera test. It can make his life at the age.
yes, I thought
Just
I should do
some talk, because some of them, like Dr. Bassel said, they can accept, or they can like refer this problem to the religious or the something that they making back beliefs from them to making permission like that. So just talk more about the threats of life and the very importance of doing this camera test. And if we will do, we can have some blood again, bleeding again, and this can harm, it can threaten his life itself, and we can lose him if we will not give him the blood.
Exactly, yes. we should talk about the serious complication might happen if he didn't receive blood or if he bleeds more. It might harm his life generally. Yes. Okay, I think this scenario since long time they didn't bring, but
Yes, yes.
This bus
But
maybe
in
maybe
Rider, yes, they bring one of.
bus test scenario.
sorry,
Bus
Bastas.
test, yes.
Mm. But in the last diets, I think they didn't bring, right?
I think if they bring it, they will bring in UK more, not in.
Jehovah,
Yeah.
yes, many. They are a lot here. They have,
Really?
still they are a lot, and they are dying. We have a patient die
Oh
because
my God.
he used the blood and he died. He bleed until die. They have very strong bleed. They are very difficult.
What
Very
are originally from?
from UK.
The Jewish, yes, this
Yeah,
is in Australia. It is more also. It is not.
and
It is
very
more
restricted.
in
They
than
like
the UK. In Australia, it is more. Yes, and this is big, like big place. They collecting them inside them. Yeah, yeah, inside it.
Yeah.
and they
Any
die.
solution they can take blood from the same group or same family,
No one. They will not take
No, no,
so they
no.
are not receiving blood at all.
at all. At all.
And
And
organ donation also. Yes,
Some of
organ
them
donation.
accept to re-infuse from the same patient. I don't know how يعني, but re-infuse from the same patient himself.
Maybe as a bank blood
I don't know.
when he was okay. Maybe he put blood like the same as the sperm bank of sperms, so he can donate blood whenever he will be sick. They will
Yes.
receive his blood. Maybe in this way,
I don't know. Maybe.
but it's too much complicated. How they will store the blood for how long?
And they
Think
are.
it's 3 months only, right?
Mm.
How he can expect what will happen for him? Anyway, hopefully it will not come to both of you or to any of you, because it's difficult to know what the examiner needs from this scenario. You don't know what's in the instruction or in the agenda of this scenario, what he wants from you to do or to talk about, or how to convince, what the weapon you can use to convince this guy or his
In the
wife.
best test, they insist on the consultant decision in the best interest of the patient, as it's life-threatening, so it's the best interest of the patient only.
If it's
There
patient
is,
capacity, yeah, you are right. It must be.
unless there is assigned document from the patient before this.
Before he is losing
Yes,
capacity.
for the condition, yes.
Mhm. Okay.
Hello.
Yes.
Yes.
Good evening, everyone. Yeah, just for Jehovah Witness, I have something I might add to you.
Yes.
From the start, there is some point you need to highlight it to the patient, okay, of Jehovah Witness, that to reassure him from the start, it's a private conversation. And why we want to say that? Because some of the Jehovah Witness that are not strongly believe, but they might afraid of family or friends. So if just give him assurance from the start, it will be private and with absolutely confidential. We didn't discuss that with other one, okay, from your friends or family or everyone, and that just for some patient might work, okay. And the other thing is to explore his understanding about the blood products. So not only red cells, we sometimes we might need to give platelets and clotting factors. So it explains some physiology about that. It's for in bleeding that there is important blood cells like what is called the red cells, which is important to carry to carry the oxygen to the organs. And if not available oxygen for them, for the organs, they will be damaged, and it will not even work, okay? And it's not going to be working, okay? And then for the platelet, it's important for the bleeding. So if there is with bleeding, there will be loss in bleeding, so the count will be low, and this will aggravate the bleeding. And the clotting factors is another thing. It's important to stop the bleeding. It will be lost in bleeding as well. Okay, so this is the kind of blood products. This is important because there are Jehovah Witness are like subtypes. Some of them just reject the red cells, not the platelets or not the clotting factors. So you need to explore which kind. And most of them, they reject every blood cells. Okay, so you need to explore that. And then if you say no, explore the next, discuss the next blood product and say no, ask him, do you accept that? No. Do you accept that? No. And let the patient know that if no, if he has already advanced directive about what in case of his capacity is low or something, any written advanced directive about that. If the patient said no, ask him in a gentle way to do that, just in case his consciousness, if it's he's got confused, and that they could use that in that situation. Okay, the document. So you need to do that with the patient if he's still not confused, and let him know that you need to formally document that. The discussion about if he reject anything, if he reject the packed cell, if the red cells, if he reject the platelet and clotting factor, that will be written down formally in a document. Okay, so if he's bleeding, he's still further bleeding and so on. So they, legally they know that when he's fully conscious and he just reject all of this kind of blood, and if he die, they that it's already documented to clear their site. Okay, that's why they didn't not just verbally. No, they need to document that, to write down. Just let him know, excuse me sir, or excuse me Mr. Flan وكده. I will document that formally, that after you ask, after you ask and he reject the third component of the blood. Okay, so what the other alternative? So Jehovah Witness, they know there is alternative things instead of blood cells from other persons. So they know that there what is called cell salvage. That it's if the patient went to the surgery or any kind of operation, when he lost his while he's bleeding, they collect the blood and filter it and give it back to his circulation. So do you accept that? Most of them could sign that and said, yes, I accept it. Okay, and the erythropoietin as well, and the laboratory clotting factor. You said, okay, do you accept, for example, laboratory that's not from other person, that is laboratory made clotting factors? If they said yes, accept it, yes, put that in the notes. And erythropoietin, explain that in short, that it's a blood, it's a protein hormone. Okay, it's a protein product. Okay, in the human, from human, and it's important to synthesize, not synthesis, it's to produce or to make, or I don't know what's not jargon word. to help,
To create
to
or
create, to
yeah.
produce. I don't know, not in a non-jargon way. It's to produce blood cells, and it's usually happen that usually released or come from, not released. It's come from the kidney, and when the kidney damage and other things, discuss the complication. And because this kind of patient, if they bleed until his kidney function is dropped down because no oxygen to the kidney, so the kidney will be stopped. So what we can do for him at that time is to do dialysis, is to connect you to the machine like artificial kidney instead of your damaged kidney, that the circulation and go. And you accept that? If said yes or no, and then just discuss these things and let him know that we be sure we respect your beliefs. We don't do any kind of pressure on you to accept that. Just discussion and document what we are discussing, okay? In case of you are rejecting things. لو هو طبعا if the patient accepting to take that, so you wouldn't discuss that with the family or friends that he accept that, okay? So like like a family or community anxiety about he accepting that. And sometimes some kind of Jehovah Witness, they could accept the blood product in case of life threatening, otherwise no. It depends on the how it could affect. Sometimes it's minor bleeding, or it could be managed, or it could be replaced. Just you know, if it severely affect, for example, the heart from the anemia, or affect the kidney or something like that, it's severely. Some of them could accept. So try to put that in your mind. There is some kind of discussion because they know many things about that cell salvage. They know about laboratory clotting factors, okay, erythropoietins, and so on. Thank you.
Okay, thank you, Dr. Dalia, for explanation. I think it's clear now about Jehovah Witness in the exam, and the solution can be offered. At the end, it's their behaves and their beliefs, and we have to respect them. If they are insisting, as Dr. Dalia said, you can document, and they let them sign refusal, and arrange a meeting with the consultant and the legal advisor at the hospital to have another talk. They might accept. Some of them can accept. But for the confidentiality, it's a good point to make it as very or top confidential, so they can be sure that no one of the family members will know, or for the friends, they will know.
Yeah,
Good suggestion. Yes.
yeah, it's two pathways. Here, the case is not to speak with the patient himself. Here, to speak with the next of kin or his wife, and he has no capacity. Yeah.
Yeah. Exactly.
Yeah. So it's different that in that way, because he has no advance directive stating that he wouldn't accept that.
So we can
Okay.
give it. Yeah.
So we
give it.
can give it,
As
but
life
not with
living.
confrontation, not with any kind of confrontation, just to discuss and explain that to the wife. And if she's didn't being convinced, just the consultant and then the legal team. Yeah, as it's already discussed by the colleagues.
Perfect.
Okay.
Yeah. Thank you, Dr. Dali. Thank
Thanks.
you. Okay. Someone wrote a comment. I want to read. Dr. Mona Ibrahim, many mentors mentioned that spouse is more powerful than next of kin, and suggested not to ask are the next of kin in this situation. Suppose in any scenario in the communication, either to talk to the patient or to the next of kin to the patient. So I don't think you can have another person who's not next of kin or not the patient in the exam. So, for me, I should ask this question if I am facing the next of kin or the person who's not the surrogate or not the patient himself. I don't know. Every mentor has his approach, so I cannot interfere with this. But I prefer to ask and to provide, confirm the next of kin. By the way, this is also in the BAS test.
Yeah, it's important, in fact.
Yeah, it's in the BAS test. I read it in all communication scenarios.
Sometimes she can be like his sister, but he has conflict with her.
Yeah.
That she's the next of kin, but she's not the next of kin. So you asked. Sometimes they put like friends, their next of kin, better than the family. So it's
Yeah.
important. You are right. Important to ask if you are the next of kin or not.
Exactly, yes. Okay, any other question or comment or adding points? Any doubts? Seems satisfied. Okay, just for clarification, the vote in the group, the result will be, so for example, this week we'll practice long clinical consultation with the communication alternatively. So every day till the end of the week, of course, the Friday is off. So LCC, then communication, LCC, then communication, LCC, then communication. So it would be 3 long clinical consultation and 3 communication. And the next week will be first day for long clinical consultation, second day for communication, third day for short cases, and so on. Just to put and to make the short cases as important as the long and communication. Just the discussion itself. Examination, of course, you will know how to do the examination in the course, but for the discussion and repeating the questions, the differential, because I believe some of candidates might fail in one skill, which is differential diagnosis, for example, or another skill like clinical judgment, or this related to the short case. Physical examination and identify the finding, I think it would be gained by the courses. But again, when you repeat the steps, it would give you more confidence while repeating and doing the steps in the exam. So we will do this in this way. So 1 week for long clinical and communication, and the next week will be for long clinical communication and short cases. Thank you for the voting, and hopefully it would be beneficial for all. Okay, thank you everyone. Thank you, Dr. Lamia and Dr. Mayada for today practicing. Tomorrow, inshallah, we'll have long clinical consultation. Anyone interested, he can direct message me. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.